another edition of the Westfield Council on Aging Presents. This is a special collaborative between Tina Gorman, who is the Executive Director of the Westfield Senior Center, and Pete Coles, who is the manager and producer of WCPC Westfield Cable Channel 15. Our topic today is Baystate Noble Hospital, our local hospital. And my guest is Ron Bryant, who is the president of Baystate Noble Hospital, and also they've got him in two places. He's also the president of Baystate Franklin Medical Center. So Ron, I've known you for a long time, since my YMCA days, and welcome to the studio. We're really thrilled to have you in with us today. So I always like to kind of treat our listening audience, our viewing audience, to an opportunity to get to know our guests a little bit. Yeah. So where'd you grow up? And I think you have an accent that may be a clue to that.
Right.
Where did you grow up, and where'd you go to college? And just
born and raised in Worcester, Mass.
Worcester.
Yeah. So we can say lobster correctly. So No, I was born and raised in Worcester. I spent most of my life there, and my mom actually still lives there. And I went to school at Assumption College there.
Oh, really?
At evenings,
okay.
Yeah. So I graduated from there.
Wow.
And I got my graduate degree from St. Joseph's College in Standish, Maine. And,
did you really?
Yeah.
Wow. So you're a true New Englander.
I'm a true New Englander, yeah. So, we're not going anywhere. We're New Englanders. And I've been in Westfield now for 11 years. Before that, I was chief financial officer. So before becoming president and CEO of Noble Hospital back in 2010, I believe, I was chief financial officer for a hospital up in Maine. That's how we ended up with the home in Maine. And then I spent some time as a chief financial officer of Martha's Vineyard Hospital. And before that was about 5 years I was there. And then before that, I was with an organization called Health Management Associates, which has now been sold to a larger company. I traveled around the country. I was in South Carolina, Oklahoma, and a few other locations. And we own 65 hospitals. And then I actually started my healthcare career at Metro West Medical Center in Framingham, Mass.
Is that right?
Yeah, and then before that, I was in finance with various different organizations in public accounting, and so.
Wow.
Yeah, my undergraduate degree is in accounting.
Okay.
And so that's where, so that's and it led me to, I love community hospitals. HMA was an organization that concentrated in community hospitals, so that's where I trained in community hospitals, and Noble's been a great fit for me, and I'm still here 11 years later.
It's amazing. It's been 11 years now. Wow.
Yeah, we were independent for my first 5 or 6 years there, and then we affiliated with Baystate Health in June of 2015, which has been a great experience for me and the organization and the community. and the patients that go there. It's been tremendous for us. And so now we're part of an academic medical center that, I'm seeing a side of the healthcare that I didn't see in the past, because I was always with pretty much standalone community hospitals. And so, there's the depth and the breadth of what they have there, the talent, and what they bring to the table for our community. It's been a great experience. It's been a great journey.
You've done a great job at Noble. I've certainly been around and watched all of the renovations and the advancements that you've had, but you've really brought the hospital to another level, I should say.
Yeah.
And as I understand it, it's doing great guns right now, and really meeting its mission of providing quality medical care to the greater Westfield community.
Oh, it's doing fantastic. I always, I don't always say, but I think often that, folks, and I remember, and you remember when I got here 11 years ago, that, you're going to fix it in a year or so, we're going to turn around and everything's going to be rosy.
Yeah.
And it doesn't work that way.
Right.
This has been truly an 11-year journey. and we're still moving forward. In the last 5 years, 6 years now with Baystate, we affiliated in July of 2015, as I said, and then it took us 3 years just to implement electronic medical records. So, when folks, okay, now you're part of Baystate and everything is good, and, well, you're really not part of Baystate until you're integrated and connected. And so that was really the first big step, was to integrate the electronic medical records with their system. And then we could, which is, I say it took us 3 years. There was 2 years of planning behind the scenes to get us there. So really, it's a bigger process than you think, and it's a long process. So once we got there, that opened the doors for us to do a lot of different things, to enhance the safety and quality for our patients, to enhance the ability for physicians to come to the community, which was big because, if you're at Baystate and you're a specialist over at Baystate Medical Center and you want to perform whatever it is that you want to provide to the community, we're on paper. And so it just doesn't work, because you can't transfer the records back and forth seamlessly. So that opened up the doors to physicians to come to the community, which is really, which has been the catalyst for the change. So now when you look at Baystate Noble Hospital 6 years later, all the physicians, primary care and specialists, are Baystate medical practice physicians. And so we can offer services that we weren't offering before. Like the women's breast program. We have their physicians that run the women's breast program for Baystate Health rotate through Baystate Noble Hospital. So women can see these physicians in their clinic, whether it's surgeries or clinic hours, right in Westfield. We do the same thing with gastroenterology. We've got 3 gastroenterologists rotating on a weekly basis through Baystate Noble Hospital, which we didn't have before. And you can have your clinic hours there, or you can, we do a lot of screening endoscopies. So we've more than doubled that business in our community than what we used to do previously. So folks don't have to travel. We've transitioned to a day surgery model. We don't do inpatient surgery. We have to stay overnight. We feel that it's better for the patient to be at Baystate Medical Center, but we do a lot of day surgery at Baystate Noble Hospital, where folks just need, whatever that procedure needs to be, and then they're home in the afternoon. We do very minimal inpatient stays on the surgery side. So what we're trying to move towards is, and really what healthcare is moving towards, and this has changed because of medicine and technology, is on the ambulatory side. Your clinic visits, your outpatient procedures. So a lot of our business right now is done on the outpatient side. Now, we're fortunate that we still have a very robust emergency department. In fact, I'll put a plug in. I hope Baystate Health is listening. Is because our emergency department is too small. We have upwards of 28 to 29,000 emergency department visits per year. That's a lot.
28 to 29,000?
Correct. Now the emergency department at Baystate Noble Hospital was built, for a lot less visits many years ago. So we're in the process now of going through that strategic planning, so that we can someday. It is my vision that we can enhance that emergency department for the community, and it is much needed. So we're going through that process now. That will be a huge step for this community. And then once, and we'll continue to build around that so folks don't have to travel out of the community for basic care. Now, we'll always be part of Baystate Medical Center, and you'll have to go there for, the higher end care that a patient may need. And that's fine, because that's where they should be for that type of care. But for care that we can provide in the community, so that approach is what we've taken, and we've seen Noble Hospital grow over the last couple of years. In fact, this year, we're doing better than we have in a long time. And I think, well, when I was there, we weren't. When I first showed up, we weren't doing too good. So we're doing better now than at any time that I've been here in 11 years, and it just continues to get better and better. the trick is that we have to, you got to have the right services at the right place. We can't be everything to everybody in the community. And I think that's where community hospitals get in trouble. But there's a lot of things that we can do that people don't, they want to stay close to home. And that's where we've concentrated. And with the ability to rotate the specialists through and to have as many primary care physicians in the community that we have, we pretty much, most of the primary care physicians in the community work for Baystate Medical Practices. There's 2 other practices that I know of that are still independent or affiliated with another organization, which is fine. That works. It works for the community, and that's good. So we really have a good continuum of care for our community where we can provide that population health that we would like to move towards, which we are moving towards, and we are involved in heavily as an organization to keep our community healthier. So that's a long-winded answer, but that has really been the vision of 10 years of work of making the community healthier. How do we do that? Partnership with Baystate Health, bringing the physicians that we need in the community into the community, and then the care that they need that we can't provide to have that seamless transition to Baystate Medical Center, which we do. And it's been well received by the community. I can say they're really starting to recognize that we are Baystate Health, that when you walk through the doors of Baystate Noble Hospital, it's Baystate Health.
To that point, my wife had some medical issues this past year, and so she started at Noble, Baystate Noble here, with one of your doctors, and then they transferred her over to Baystate in Springfield. And what was nice was the seamless transition between the two, because when she was over there, all her records were there automatically.
Absolutely.
They were, even though we were over here, we're over there, it was still as one.
Right.
And now this doctor was handing her over to another doctor over there, but it was a seamless transition. So you really felt like you're part of a much larger system, and a system that was really there designed to take care of you and look out for you.
That's right. And we have a ways to go to improve that. It's pretty good now, but we can get better at it, and we can get better at access for our patients to wherever they enter the door of Baystate Health, which we have strategic plans to do, which is easier said than done, especially in healthcare. But yeah, so the goal is to just continually improve upon what we're offering, and to take care of the community as best as we possibly can. And I couldn't be more proud to see the transition over. You were there the first week I showed up.
I know.
In 2010, and
I remember that very well.
And to see it transition over 10, 11 years to what it is, and going strong.
Right.
But it takes change, and change is hard. Communities are really endeared to their community hospitals. There's a lot of passion.
Right.
But what works for us is we're 8-9 miles away from Baystate Medical Center. That allows us to do a lot of different things. And it's a great community where physicians and nurses and providers and folks like to come to work. And so that has been a really good encouragement. And so it's knock on wood.
Yeah.
Now it hasn't been perfect. There's been pitfalls too, but I'm pretty proud of what's happened, and a lot of people help us.
You should be, and I think that what's important for our community to realize as well is the fact that you can't take a community hospital for granted. If the funding isn't there to maintain the services, to upgrade the facilities, to upgrade the equipment, chances are good that they aren't going to make it. And we know that there's examples, and I remember 11 years ago having this conversation with you, of hospitals that no longer exist in our community because they were unable to make that transition, and they could not secure the financing and make sure that they were solid. So kudos to you, and I also want to put a plug out to John Shaver, who is your number one finance guy there, the CFO, who's done a phenomenal job for you, and I think he's bouncing back and forth as well between the two. I'm impressed that you're able to, knowing the challenges of what you have here, that you're able to also balance your time. It's probably you add to the number of hours in your day and weekends probably, but the fact that you're also running the hospital up in Franklin County, which is in Greenfield,
It's in Greenfield.
Greenfield, yeah.
Well, that's part of the vision of Baystate Health is as we, transition to more population health and how we take care of our communities, we have to look at having solid teams
Right.
on the ground. And so
Right.
part of my job is to make sure, or at least encourage and promote that we have solid teams at the organizations. Because a lot of things have changed, Harry. When I was first there, departments like radiology and lab and even things like GI and the physician clinics is all reported up to me, and that is I still have oversight and I'm heavily involved, but they report up to the folks that are experts in that area, which is the right thing, so that we have the best practices and the evidence-based care in radiology. So the chief of radiology for Baystate Health oversees that radiology program for the system. That's just one example, but that's how all our service lines work. So the chief of heart and vascular oversees the cardiology, right, the heart and vascular programs for the system. So we have a regional approach to offering cardiology, and we do this, and that's what's happened at Baystate Noble Hospital. We've added a second cardiologist. We're looking at a third. We're busting out of the seams in that area because, we have an aging population in Westfield and we need it, and we're pretty much the only cardiologists over here. So when you look at that way, you get the evidence-based care, you get the best practices, it enhances the quality that we're providing, the quality of care that we're providing to the community, and it makes each other's jobs easier. And we have to put trust in each other that
Right.
the experts know what they're doing with their service lines and the integration. So from that standpoint, a lot of my work is on the strategy side and helping move that vision forward, so that we could then have multifaceted services in each community that need to be there. So that's how it works. I think, you couldn't, if they were both independent, you couldn't do it,
Right.
But you get economies of scale,
Right.
which, sometimes is, they say, oh, you're going to combine this and that and you're going to save a lot of money. It really doesn't happen.
Yeah,
You usually end
right.
up spending money. But where we make out is we get the expertise that you just couldn't get as a community hospital.
Right. So let's target in a little bit because this is part of the Westfield Council on Aging Presents series of really in catering to the senior population, which you just alluded to in Westfield. So from the standpoint of our seniors here, they should still think about Noble, Baystate Noble. I still refer to our former Nome, but
I
Baystate
do the
Noble,
same thing sometimes.
right,
Yeah.
as their hospital of choice. This should be their first stop when they've got
Absolutely.
issues or
Yeah.
concerns that they don't feel that they need to go to Springfield.
Correct. Nothing has changed for that. Now, obviously, if they need if they have trauma or they need tertiary care, right, then they will either be ambulanced, right, because there's
Right.
a high acuity event, so they'll end up at Baystate Medical Center first, or if they come to our hospital and we see at Baystate Noble Hospital and we see that they need to be transferred, like you mentioned, that would be a seamless experience for them. However, many times they don't have to be, and they would be, right here in their own community and get the care that they need. So, and that's really the goal. About 25% of our population is in the senior center, the senior
Yeah,
category, and
Of which I have now become one of them,
Well,
unfortunately.
I think I'm just about there. And we were a little younger.
Yeah.
But that's the goal, really. Yeah, they should absolutely. And we see a lot of the folks. We have a great relationship with Tina Gorman down at the senior center. We have a nurse there on a part-time basis.
Oh, you do?
Yeah, and that was really, that was something that I was adamant about, that we have to provide a nurse for the senior center for the community. So they absolutely love it.
Oh, that's
And,
interesting.
it
So
was
people
well-
can get like blood pressures or stuff,
absolutely,
things of
yeah,
that nature
yeah.
there?
And I think they're either 2 or 3 days. I don't know the exact hours that they're
Right.
there, but and I don't know how it's worked through COVID because a lot of things have been different.
Right.
But yes, and we have a great partnership with them, and Tina Gorman sits on our Community Advisory Council, which Baystate Noble has. So we have Westfield leadership on that advisory council that they basically hold us accountable. And okay, what are you doing for us? And you're moving, and they ball forward, and they give us input.
Okay.
And then a really nice thing about the affiliation that I am a little passionate about is we have what's called the Community Benefits Advisory Council. And this is a council that we're required to give back to the community, right? To work on things such as the social determinants of healthcare, right? So it's part of our mission. And we have this committee is made up of community members, right? Agencies, skilled nursing facilities, Tina Gorman at the Senior Center, the Public Health of Westfield, and various other, right? Bill Parks from the Boys and Girls Club sits on.
Oh, yeah, sure.
And the goal is to promote the social determinants, whether it's food, whether it's housing, whether it's transportation, and how can we do this? And each year there is some dollars available through some of Baystate Health's work, and we hold requests for proposals, and we go through that. And then so that is something that I want to build upon, so that we can help the communities in other ways, so that it makes the living better, the community healthier, so that they
Right.
don't have to come to our hospitals. And then we got a long way to go on that, but it's in its infancy, and we're doing good work.
Yeah, and I would think that you have an excellent working relationship, obviously, with the fire department and the ambulance service here in Westfield, so the seniors can feel comfortable knowing that if they require an ambulance, the ambulance service here in Westfield is very adept and well acquainted with your emergency department. They know exactly where to go,
Absolutely.
where to take them, and how to handle that situation.
So we have communication with all the towns, including Westfield, because Westfield obviously is the largest with the ambulances, and there is a monthly meeting. So
really?
They go through the checklists
Okay.
of what's working right, what's working wrong, what can we do better, what types of patients can we take, what types of patients can't we take. And we've actually seen our ability to take more patients grow in the last year.
Oh, wow.
Last 2 years. So that has been a bonus for us, and it's a bonus for the community. So there's close contact with the ambulances of all the towns, and especially the hill towns too. We are the go-to emergency department for the hill towns. In the Hilltown Community Center, we got
I didn't realize that.
Well, there's 16,000 people to the west of us that we are their primary care hospital. I mean, we are it for them.
Oh, that's interesting.
So we take that seriously, that mission seriously, and so we're in close contact with them because it's important for them. I mean, we could save lives. And so, yes, to answer your question shortly, those relationships exist, and the communication exists on a regular basis.
Right.
So they should feel comfortable that that's happening.
Right. And the one thing that I also want to remind our seniors, and this came out in one of our earlier shows that we produced, is the fact that if you don't already have it, you can get them from the senior center, but it's the medical care, the medical card that lists all of your personal medical information, and who your emergency numbers and who your emergency contacts should be. But all of those factors should be aware of, you should be aware of that. That goes on your refrigerator door. So it gets filled out, you leave it on your refrigerator door, and then when the ambulance, if they are called and they have to come in and you're not able to talk to them, they know to automatically go to your refrigerator door, find this card, and they will take that with them to the hospital. So they have all of your information you need. So make sure you get that filled out and put that on your refrigerator door. But that's one of the things I learned about, and we're doing the same thing in our home, is getting that little card filled out. So from the standpoint, from the standpoint of the seniors, is there ever a time that they should just think that, oh, I should be going straight to Springfield and bypass Noble, or should they really always look at Noble as their first stop?
So that depends, right? It depends on how you enter the system. So let's say it's by ambulance, right? Which we don't want that to happen.
Right.
The ambulances will know.
Okay, so they make that
So
determination.
they're trained in that.
Right.
And then if you do end up at Baystate Noble Hospital first, and we believe that you need to be at BMC, you'll be transferred over to BMC. Now, for specialists, right, that depends on the what the need is, right? So you have primary care, and the primary care is going to make the decision, okay, what is it? You know, if it's a, let's say you have to go to the women's breast program, right, for a clinic visit, or you've got a routine endoscopy screening, right, or you've got you want to see a cardiologist, those can be scheduled at Baystate Noble Hospital. Mm-hmm. Now, let's say the cardiologist says, you know what, you need, you know, some other type of procedure that we don't do at Baystate Noble Hospital. Then you would be referred to Baystate Medical Center and the specialist there, because that's where those procedures are performed. Mm-hmm. You know, there are procedures that you don't, you know, that we don't do enough of them in the community. So you want to be with the specialist that does them all the time, right? Mm-hmm. And is trained in those specific specialty areas. So, and that's how that would work.
Okay.
You know, a good example would be like a colorectal surgeon. So if you were referred to a colorectal surgeon, then you would go to Baystate Medical Center. They don't rotate through Baystate Noble Hospital.
Okay.
You know, another example would be like a pacemaker, right? We don't do those at Baystate Noble Hospital, although we could, and we're looking into that.
Oh, interesting.
And we used to do them in the past. So that would be another example. So things like that. So the system would navigate you, and hopefully it works well for the patient that they navigate through the system well. And for the most part, we do a good job, but we have room for improvement in that area, I think, as every healthcare system does.
Yeah, right. And I'm making an assumption, so I'm going to ask it in a kind of a question format. If people have ambulatory issues of getting to the hospital, you don't come to them. They've got to find a way to get to you. Is that correct?
Well, that would be through an ambulance.
Okay.
So if they can't, you know, if there's, I come up with an example, but if they need immediate care, right, the hope would be that somehow an ambulance was alerted to go to their home. Okay. So even if they contacted us, we as ourselves don't go, we would have an ambulance go there. Mm-hmm. We also have a program that's called Dispatch Health. And what that program is designed to do is to keep folks from having an emergency department visit. So, you know, you could have some I don't know, I can't think of an example off the top of my head, but these folks are actually, it's a physician, and they go to the homes, and they prevent an emergency department visit for that particular patient.
Really?
Yeah, so that is something that is out there. I don't think it's working in Westfield at the moment. It's Springfield and a few other areas east of the river. Mm-hmm. But eventually we would like to have it come to Westfield. Mm-hmm. So there's programs like that out there. But for the most part, if somebody really needs to get to it would be through an ambulance. Mm.
Does the hospital provide, in either here in Westfield or even in Springfield, but any kind of a lecture series or information series of people that they talk about certain preventative measures or
all the time?
Okay.
So, you know, we're constantly in the newspaper. We're constantly on social media. We do things with the senior center. We try to get our physicians out there to educate the communities. Okay. Depending on what season it is, you know, if it's flu season.
Oh, sure.
You see the Baystate Health commercials about getting the vaccine for COVID. You know, we have 3 different physicians on that commercial, and so there's a ton of outreach. I've been sold on the social media. I don't use it myself, which I probably should, but really it's amazing that, you know, that's where it is. That's where it's
Right.
happening.
It's a
That's
great
where-
way to communicate.
and that's where folks look. So we have a marketing department and a team that
Okay.
works on all of that. That
Okay.
really gets the message out, and then we try to tailor it to the communities, as best we can to let them know what's going on in Westfield and at Baystate Noble Hospital. For instance, like the colonoscopy screenings, everybody that reaches a certain age gets a card in the mail. Say, okay, and this is it. It's your time, and so hopefully they come and use Baystate Health Services.
Yeah, unfortunately, I think my time is coming rapidly. I think it's about 9 years since I last had mine. Now
Well, I'm right there. I think it's myself too.
Oh, I love that time. You
Or you can go to Baystate Noble Hospital.
yeah, that's where I do it, right here. Done my last two there. You mentioned shots, which just triggered a thought. Flu shot and obviously COVID shots. Are those? I know that you do COVID testing there. People can come there as well to get their shots.
So we were standing up clinics for the public, right? For them to receive their shot. We no longer stand up clinics for the public, although we do have mobile vans.
Okay.
That are out there. So, for instance, the pancake breakfast, we had a mobile van at that. That was over in Springfield.
Oh, okay. Sure.
I'm sure we're going to be at the Big E.
Oh, yeah. Sure.
So there's I personally have not looked at this, but I'm sure there's something on our website that can direct folks of how to get a vaccination shot. And if not, we call the hospital. We'll find one for you.
Right.
But those things are also available in the Walgreens and the CVSs
Right.
of the world. So it's pretty easy to find access to a shot.
And people should be thinking about last year. I heard that there was like little to no flu symptoms because everybody
Correct.
was masked
We
up.
had a
Everybody
mask,
was
right.
at home.
So masks
it's-
work.
So it proves that masks work. But this year I am hearing that people should be thinking about getting a flu shot. Is that correct?
So I'm not sure. That's how I'll answer that.
Okay,
Because
fair enough.
I don't know the answer to that.
Okay.
I'm not an infectious disease expert or an
Okay.
epidemiologist, and I haven't had the conversation if you could get the flu shot and the COVID shot.
Right.
But we can follow up
Yeah.
on that.
And I'm sure they can, if they've got questions, they can probably talk to Tina Gorman and she can help them find
Oh,
access to
absolutely.
information.
And we'll get something up on our website.
Yeah.
And honestly, I should know that, and it just hasn't crossed my
Yeah,
mind.
no, that's okay. You got a lot of other things to worry about. I am curious though, just how, and people do worry about COVID. We thought we were on the downslide finally, and then there's been a serious uptick with the Delta virus variant, and I'm hearing that there's another mutant out there. How is the hospital being impacted by that, and how are you handling that as far as, are you overrun? Can people still come in and get their other type of medical cares? I mean, we're hearing awful stories
All
across
kinds
the
of
country.
stories, yeah. So it's challenging in the system. We have on average every day about 100 COVID patients.
Oh,
which
really?
we are now the COVID census that we're experiencing is now higher than what we experienced in the second wave of
Really?
COVID last winter.
Wow.
So the Delta variant is real. We have 5% of the beds in the state. We see 15% of the hospitalizations in the state in Baystate Health. We're averaging right now between 8 and 10 patients a day at Noble Hospital. So that shows you that, we need to do a better job of getting vaccinated and wearing masks and washing our hands in Hampden County. I think we're at somewhere around 53% vaccination rate in Hampden County. I think Westfield is about the same. We're one of the lowest in the state compared to Central Mass, which is around 70%, and it's even higher in the east. So that has been a factor for us. So yes, we have a lot. We're seeing a lot of COVID patients in because of the Delta variants, predominantly the Delta variant, and it's been very taxing on the hospitals. Compared to the first wave where the state mandated, elective surgeries and the like to shut down, we're keeping operations open. So it's absolutely safe to come to the hospital. We're keeping operations open. You should still get your routine care and screenings and all of that. We're still having day surgeries and endoscopies and the like. So, however, like across the nation, it's put a strain on staffing. I mean, and the healthcare industry is not alone. Folks have decided, to retire early. Right. They just, they don't want to deal with it anymore, whatever industry you're in. Right. Or there's issues at home with child care and the like, so they stay home. And that has compounded our ability to find support staff and to find nurses. And it's put a strain on our system. And that's across the country, but we're not immune. We are feeling that, and it's been difficult for us. So most days, in fact, just about every day, I should say, we're working on, okay, how do we work this? Where do we find nurses? How do we bring in nurses? How do we make sure that we have enough support staff for the nurses? And how do we give people time off to give them a break? So they're not working, 7 days a week. And so there's myriad of issues, right? You got your personal issues, you got your business issues of staffing the hospital, and it all compounds into how do you keep your business running. It's like any other business, right? You see it out there, restaurants and the like. It's difficult. Right. So we're not immune to that, and it's been a challenge, and and that's been the so the challenges now are different because we're open. And hopefully, it subsides. Again, I'm not an epidemiologist, but I'm told that maybe, in 4 to 5 weeks, we'll see the curve go the other way.
Oh,
it's kind of leveling off. We've been hovering around 100.
Okay.
But we got the big E coming, which has, at least me concerned because, Noble's ED would be a it's the proximity to Agawam. We're right there. So we have to prepare for that, and we're having those conversations that in 3 weeks, what happens? What do we do? So, one thing about healthcare and hospitals, we're very good at preparation and doing what we need to do in difficult times. So we're working on that.
I just had a thought and I just lost it.
Well, that happens.
Yeah. So from the standpoint of COVID, though, that should not scare people off from coming. And obviously you're working your way through it. I know what I was going to say.
We have the precautions in place.
I'm fully vaccinated. And I think that, if you follow the science, and I don't want to get into any political discussions with people around this, but it's proven that the shots work. And if nothing else, even if you're exposed to the Delta variant, you may get sick, but you're not going to end up in the hospital. It's going to save your life, and that's the most important thing.
Correct. Absolutely. Your chances of being hospitalized if you're unvaccinated are 10 times higher. So that's a significant increase.
That's a huge, right.
So I have a stat here, is less than 1% of vaccine breakthrough cases have died from COVID-19. Less than 1%.
Wow, okay.
So, that just tells you that, get vaccinated, wear a mask, wash your hands, and social distance.
Right.
It works.
Do you have any updates at all on the booster that we've been hearing about, or is it still too early?
So it's up in the air still.
Yeah.
And that's my latest. As it was mentioned to me, it's on ice, no pun intended. And so we'll see. It's a wait and see.
Yeah, okay.
Yeah, it's a wait and see.
Right.
Yeah.
But the important thing is, at least if you haven't already, definitely get your shot and
get vaccinated.
It helps you. It helps your family. It helps our community.
That's right.
Helps the hospital. Yeah.
Yeah. And we want Hampden County to be as safe as possible.
Right.
And I'm vaccinated, and of course, and but when I go to the store or anywhere, I still wear my mask. I go to the Big Y just about every night because that's what I do, and I got my mask on.
Yeah. Right.
And just for that extra precaution, and obviously to lead by example, that these are the best practices that we should be doing.
Well, I think that given the population that we're kind of talking to today is the fact that you do want to be as safe as you can. So as you listen to Ron, common sense practices that we've been hearing about: wash your hands, wear your mask, social distance when you can, and stay out of large, close groups of people.
Absolutely.
As much as you can.
Yeah.
And it's been difficult. I was sick of the mask, and so when we finally got the go-ahead to stop wearing them back in the spring, I guess, early summer. I'm trying to remember when that was. It was like, oh my gosh, this is so nice to not have it and be able to get outside or go into buildings again. And, it's just tough to have all these restraints put on us. But, we've just got to be vigilant and do what we can to help us get through this next wave, especially with our children and, and families.
Yep.
But, so from the standpoint of the seniors, we definitely need to be as vigilant as we can. Are there any other, you have any other new additions or renovations scheduled for the hospital that people would be interested in hearing about?
So not other than my and again Baystate, I hope they're listening. Is the emergency department's a biggie. I mean,
Right.
that is that's my dream.
Right.
And then there's we've done a lot of renovations over the years. Some of our clinic space is beautiful. We got the new lobby, we got the canopy out front.
That came out nice, by the way. It's great for dropping off people and staying out of the weather.
It's fantastic.
Yeah, right.
We've got
Very nicely
some
done.
state-of-the-art radiology equipment that's in there now. It's pretty much all brand new. We've got 2 new radiology plain film rooms. I think we got 1 left to do that's renovated. And these are significant capital dollars. All ultrasounds, things like that, new CT. So these types of things have all been changed out with the good graces of Baystate Health. State-of-the-art equipment for our nurses, like all our biomed equipment used to be, 3 of these and 2 of these. It's all one company so that the nurses, okay, if I'm in this room, it's the same equipment as the next room.
Yeah,
and
right.
so they're not thinking, okay, something's different, and you don't want that. And so a lot of that. We are looking at the rest of the facility as to what we do with it, as far as, can we consolidate some clinics on site? Can we add some specialty services? How do we make it more useful? Cardiopulmonary rehab comes to mind. We have a space on the 3rd floor that we've allocated dollars and still have ball funds for, that we need to rehab that to give a nice state-of-the-art cardiopulmonary rehab program, which is a pretty good program for us. And we're the only one over here in this region that has that cardiopulmonary rehab program. So that comes to mind. But I think the biggie would be the emergency department.
Yeah.
That would be a very visible thing that folks will say, okay, you know what, the hospital's really changing.
Right. And chances are, if you haven't ever been there, there'll be a point in your life where you may make a visit. It's hard to say how many people have never been there, but we will.
I'm amazed at how many people covet that emergency department. I talk to a lot of people in the community about Baystate Noble Hospital, and every one of them mentions that they use that emergency department. And I think it's been we're lucky that Westfield and Greater Westfield and the hill towns have an emergency department.
Right.
And it's connected to a medical center like Baystate.
Right.
So we have to protect that and covet that.
I want to ask you, just triggered a thought. On Union Street, you have the urgent care.
We have the urgent care there, yeah.
When should people think about using that? If they've got an issue and they say, well, I've got to go into the hospital, I want to have this checked out, should they think about the urgent care over?
Oh, absolutely. I use the urgent care.
When do they use one over the other?
Well, I'll give you an example. I woke up one day and my eyes were all swollen and I couldn't figure it out. And I goes, what am I going to do? So I go over to the urgent care and it turns out it's allergies.
Okay.
So if you have a sore throat, you might have a pain. If they believe that, like, if you have chest pain, you go to urgent care, they're going to send you to the emergency department.
Okay.
So, and they're going to get you over there. So we probably do that 2-3 times a day on average. So that, it's not going to be like you go there and it's for naught. But if you have a minor bump or bruise, or, you think you got the sniffles, or, you have a sore throat, those earache, those types of things, absolutely the urgent care. Because, you're going to be pointed in the right direction anyways.
And that's all part of the Baystate system.
All part of the
it's-
Baystate
it's-
system.
It's so whether you're there or here, they've got
Yeah.
your records, they have access to your records. It's not like you're saying, well, I shouldn't go there because they won't know who I am.
Correct.
They're going to have the same facility
Correct.
services or help you gain the services
Yeah.
that you need.
Yeah, and on Union Street we have primary care. We got the OBGYN practices over there, which are part of the women's health program that are still going strong.
Oh, wow. Okay.
And we got the lodge practice out in Feeding Hills still, and we got the urgent care out there in Feeding Hills.
Okay.
Yeah, so we've got a pretty dominant presence
Yeah.
of primary care.
Yeah, you really do. Well, as we wrap up here, this has been a great conversation. Is there anything?
I didn't know I had this much to say.
Oh, you've always got something to say. But is there anything else that you can think of that we haven't chatted about that you want to share, or we've covered a lot?
I just gotta, one, I gotta thank the community for all the support that they've given Baystate Noble Hospital and Noble Hospital when we were independent. They stuck by us, and it's really, without the community, it wouldn't be a success. And the outpouring that we have had from the community during COVID is really, it really pulls at your heartstrings, because we've had more donations. Whether it is, they must think we're really hungry, because we have seen more. Everybody wants to feed us, and
That's funny.
and we like to eat anyways. But but the outpouring has been tremendous of how can we help, and the parades by the hospital of the fire department and the police department, and the camaraderie. I mean, it really brings people together, and unfortunately it's for a pandemic, but it has shown the closeness of the community and the importance of healthcare and having it here. So I got to thank everybody for that. Because we can have and we do, and it will get better and improve, a pretty special little hospital. We just got to keep in mind that we got to continually look at what the future is of healthcare.
You're right.
And bring that healthcare future to us.
Right.
And that can be painful sometimes for folks, but it will mean we have healthcare in our community for a long time, which is the goal.
That's great. Well, Ron Bryant, president of Baystate Noble Hospital, I want to thank you so much for coming in. And I certainly want to say to our viewing audience here, feel secure in knowing that we have the finest medical care you can find in the area, and certainly being tied and a part of the Baystate system. They have full access to all of your records, so whether you're here on Court Street, or if you are at the urgent care on Union Street, or if you're in Springfield at Baystate, you're going to have everybody working for your best interest, and they have full access to all of your records. So, kudos to Reuben Noble, who established
Reuben Noble
hospital. I don't know what year that was. I don't want to test you on your dates.
I do. It's like the late 1890s. So it was built somewhere around 1896, 1898, something like that. The original hospital, which I still have pictures.
But we should not take for granted the fact that we do have our own community hospital, obviously servicing the greater Westfield community, including the hill towns. But, again, kudos to you and your staff, especially in the conditions you've been working on. Certainly want to say thanks to all the doctors, the nurses, and staff for doing the great job that you're doing. I want to say thanks to Pete Coles, our WCPC Westfield Cable Channel 15 manager and producer, for his help and support to make this show possible. And on behalf of Pete Coles and Tina Gorman, I'm Harry Rock. Thanks for tuning in to another edition of the Westfield Council on Aging Presents. We'll see you at the next show. Thanks so much.